In a controversial move, the U.S. government this week cut the number of vaccines it officially recommends for children for the first time ever. The CDC now advising vaccinations against 11 diseases, dropping broad recommendations for flu, hepatitis A and B, rotavirus, RSV, and some forms of meningitis. The changes were pushed by Health Secretary Robert F. Kennedy Jr. and approved by President Trump. They say that they're designed to rebuild trust in public health. But pediatricians and public health experts warn this could make it easier for preventable diseases to spread. They argue the changes were made without public review or scientific transparency and say it's happening as vaccination rates are already slipping and flu deaths among children are rising. States will still decide which vaccines are required for school. Joining us to discuss is Dr. Vin Gupta, pulmonologist and NBC News medical analyst. Doctor, thanks for being with us tonight.
Good evening, Joyce. Thanks for having me.
We have a lot to cover here. So let's start with parents. If they're hearing that several of these vaccines are no longer universally recommended, what are the risks to their children if they skip some shots like the flu, RSV, or hepatitis?
Well, all those diseases that you just mentioned, Joyce, are serious conditions in children. We have a very different disease burden than places like Denmark, which is now being used as a comparator country. I'm sure a lot of parents out there are hearing about Denmark now in ways they didn't expect. And that's what the senior leadership under the Trump administration is trying to reflect, that somehow we should have a vaccine schedule similar to Denmark. Denmark does not have issues with childhood flu. They don't lose 300 children on average in a bad flu season to flu like we do. They do not have an issue with hepatitis A or hepatitis B or rotavirus for that matter. These are not problems in Denmark for a variety of reasons, but they are problems here in the United States. So the parents out there thinking about skipping because this guidance has changed or asking questions, by all means ask questions, but certainly don't skip. Ask a question to your child's provider to get clarity.
Diseases like the measles and whooping cough are already ticking up. So how worried do you think parents should be about outbreaks in their own schools over the next few years?
I hate to say it, but we're already seeing the results of a year of ideological tenure by the health secretary having its impact. We're seeing schools like in New York City actually shut down for a few days due to flu surges. We're seeing the worst measles outbreak in 30 years. So this is pertussis, whooping cough. This is already happening, Joyce. I think that's the problem, is it's already happening, and it's happening because of similar decisions that have been made over the last few months, creating confusion. Shared clinical decision-making is the buzz phrase these days, but what does that really mean? A lot of people don't really know what it means. It causes much more churn for the doctor, the pediatrician, and parent to have to add yet another thing in that 15-minute visit to talk about. So all they're doing is creating confusion, and it's reflected in the fact that vaccine rates for, say, flu have never been lower. We're talking about rates far lower than they were pre-pandemic, and that's why we're seeing what we're seeing.
And a lot of parents, they've seen some of the headlines saying that some shots are for high-risk kids only. So what should a mom or dad bring to their pediatrician, for example, if they're trying to figure out which vaccines their child really, truly needs still?
Well, I think, let's be clear. Nothing has changed from a scientific or clinical perspective to justify CDC's announcement yesterday. So if you're a parent out there wondering, should you just continue to do what was recommended, say, at the beginning of this year, January 2025, or even 3 days ago, the answer is yes. There is no need to change course whatsoever. Luckily, insurance will still continue to cover these vaccines. There's no impact. And if parents and I hope parents will decide to continue to get those 6 vaccines: rotavirus, hepatitis A, hepatitis B, COVID, flu, and meningococcal vaccines. These are the 6 that are now suddenly in question as being part of a shared decision-making process between parent and provider. Parents should still say yes to them, because all these illnesses, Joyce, you and I didn't talk about this, say, last year, right. Hepatitis A or hepatitis B or rotavirus, because the vaccines were doing their job. Just a quick stat for your audience, prior to the broad implementation of the rotavirus vaccine in the United States, we had 70,000 pediatric hospitalizations, sometimes in a given year. because we didn't have that vaccine. We don't talk about this because these vaccines have been successful.
Right. So let's talk about parents who might be confused, especially if they have infants or kids with asthma or teenagers who are due for HPV and meningitis shots. What is your message about which vaccines they should not delay and why?
Well, there shouldn't be any delay. You mentioned asthma, underlying condition. You should not delay any of the vaccines on the routine childhood vaccine schedule, but specifically the ones that are being now discussed. RSV for a child with an underlying condition is important, especially on the younger age spectrum. COVID and flu shots. If your child has been any underlying medical condition, they're at higher risk of a bad outcome from any of those respiratory viral illnesses. So seasonal vaccines against those are still very important. You don't want to delay that, to your point. You don't want to wait, potentially have an infection and a complication. HPV should be something that is recommended in early teen years. And that's something that, again, there's no reason to delay because we have no new scientific evidence or data to justify that. And meningococcal is something that is really important, especially as folks are in adolescence and move on to college. I mean, this is a serious infection that can really cause significant complications, especially in congregate settings like dorms. And so none of the vaccines here, I think just bottom line, Joyce, there is nothing here that has changed from a scientific or clinical lens to confuse people. Operate like you did last year at your child's pediatric vaccine or pediatric appointment. Whatever you were talking about, I'm sure vaccines came up in that conversation at some point. Nothing has changed, and nor should it change because there is no data to suggest it should change. Continue to operate as you did last year.
Dr. Gupta, we so appreciate you always breaking this down for us and giving us advice, especially us parents. Thank you. Appreciate your time tonight.
Thank you.